Hello, my name is Lauren Harrimans. I'm a student at Saginaw Valley in the FNP program today. I'm going to perform a full head-to-toe assessment on you today. What brings you into the office?
Just my annual exam.
Your annual exam? Okay, great. So we're going to start with cranial nerve number 2. So that's visual acuity, the optic nerve. So we're going to start with the Snellen chart. I have it up here on the wall. So if you could stand up with me, and we're going to walk over here to 20 feet in front of, you can walk up a little bit closer. Okay, and now I'm going to have you cover one eye at a time, and I'm going to have you read the lowest line that you can read. So cover one eye and read the lowest.
LPED.
LPED. Okay, now switch.
LPED.
Okay, and then if you could tell me, this is going to assess the color blindness. If you could tell me the first color line that you see.
Green.
And then the one below it?
Red.
Okay, perfect. And then you can have a seat. And as he got up and walked to the Snellen chart, I assessed his gait, and it's symmetrical. His hands are swaying as they should. We're going to test for near vision now, so we're going to use the Rosenbaum. I'm going to have him tell me what direction the E's are turned. We're going to hold this 14 inches in front of your face. So if you could just tell me, read the lowest line and tell me what direction the E's are going.
E.
Just tell me what, either left, up, down, right.
Right, down, up, down, right, left.
Okay, perfect. So that's 20/40, and on the Snellen chart, both eyes were 20/50. All right, so now I'm going to examine your eye structure. I'm looking at your cornea, your sclera, your lids, symmetry and color of the eyes. Can you look at me, please? So his pupils are symmetrical. His iris is blue. His pupils are round. But your sclera is nice and white. Your cornea is clear, no discharge, no inflammation noted. I'm going to look at your conjunctiva sac now. Nice and pink. Not red, no drainage, no inflammation. Another test we could do would be corneal reflex check. So I would swipe his cornea. This checks the integrity of his trigeminal and facial nerves, so his eyes would react and blink and water. So this helps if there was a foreign body in the patient's eye, or if there was a bright light, it shows that the nerves are indeed intact. So I'm going to move on now, and I'm going to do pupil constriction. So I'm going to have you look at me. So starting out, patient's pupils are about 6 millimeters. And they go down to 3 millimeters. Okay. And next is consensual. So I'm going to shine this light into one eye, and I'm going to see if the opposing eye constricts with it. And it does. Okay, next we're going to do the cardinal field of gaze. So this is checking cranial nerve 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve 6, abducens. So I'm going to have you follow my hand. Don't move your head, just follow with your eyes. All right, perfect. Next we're going to move on, and I'm going to do convergence. So I'm going to have you follow my finger. I'm going to make sure the patient's eyes move midline with each other, symmetrical. Okay. And next is accommodation. So I'm going to have you look at an object close, and a patient's pupils should constrict. And then I'm going to have them look at something in the distance, and they should dilate. So if you could look at the tip of my pen here, and then look behind me at the wall. And look back at the pen, and then look at the wall. Okay. Now I'm going to use my ophthalmoscope, and I'm going to look at patient's optic disc. I'm going to look at the vessels, so the arteries and veins, see if there's any hemorrhaging, masses. And I'm also going to look the optic disc and for the red reflex. Okay. Come over here. Alright, no hemorrhage, no masses. Optic disc is nice orangey pink. Same on this side. arteries and veins look normal. No masses, no hemorrhage, and the optic disc is an orangey pink. Alright, now I'm going to move onto your head. Is it okay if I move your hair around a little bit?
Yes.
So I'm looking at patient's skull and face. It's symmetrical. I'm going to look at the texture and tone and color. So patient has a dirty blonde hair. Texture is nice and smooth, a little coarse. And I'm looking at the evenly distributed. He has nice, thick hair throughout. Evenly distributed. I'm going to look at patient's skull, looking for any lesions, dandruff, infestations that should be noted. Okay, nothing to note. Skull is intact.
No dandruff.
No dandruff either. Okay, now we're moving on to cranial nerve number 5. So this is trigeminal. This is the sensory. So I'm going to use, I don't have a cotton swab, but I'm going to use this paper towel, and I'm going to swipe during the throughout the 3 branches. So ophthalmic, maxillary, and mandibular. I'm going to see if patient's able to have sensory in those areas. You can feel this?
Mm-hmm.
Feel that?
Mm-hmm.
You feel that? Okay. Good. Now I'm going to have you clench. So I'm going to look at the contraction of your masseter muscle. So if you could clench for me, and then clench up here. I'm feeling your temporal. Nice strong contractions in both areas. Okay. Now we're moving on to cranial nerve 7, which is the facial nerve. So I'm going to have you smile for me, frown, puff up your cheeks, and raise your eyebrows for me. Okay, facial nerves are intact. I'm now going to palpate your sinuses. Let me know if you have any pain or pressure as I'm touching the frontal. Any pain?
No.
And then the maxillary, any pain?
Nope.
Okay. Now I'm going to move on. So, the facial, maxillary. I'm moving on to cranial nerve number 1. So this is the olfactory. First, I'm going to check the patient's patency of the nares. So I'm going to occlude one nair at a time, breathe in and out. And then breathe in and out. Okay, nares are patent. I am going to have patient close eyes, and I have 2 different scents. I'm going to see if he's able to differentiate between the 2. So you can close your eyes for me. Take a smell.
Coffee.
Okay, keep your eyes closed. Okay.
Is that vanilla?
Vanilla, yes. Now I'm going to examine your nose. I'm looking at your nasal mucosa. I'm looking at your turbinates. I'm looking at your septum. Your septum isn't deviated. I'm looking for any polyps. Nasal mucosa is nice and pink. Terminate is nice and pink. No polyps, no bleeding, no inflammation. Noted. Nice and pink. Again, septum isn't deviated. I'm moving on now to cranial nerve number 8. So this is acoustic. Do you have any problems with hearing? Do you have any pain inside your ear or around your ear?
No.
Okay. So I'm going to check the Otis. I'm going to do a couple tests. First, a hearing test. So I'm going to do a whisper test. I'm going to occlude one ear. I'm going to whisper something into this ear, and you're going to repeat after me, okay?
1, 2, 3, 4.
Okay.
Hello, goodbye.
Okay. Now we're going to use the tuning fork, and I'm going to assess, I'm going to put the tuning fork on, and I'm going to place it in the middle of your head, and you're going to let me know if you hear the sound equally on both sides or if one side is louder than the other, okay?
Yeah.
Equal or stronger on one side?
Stronger on the right.
Stronger on the right? Okay. We're going to do it one more time.
Stronger on the right.
Stronger on the right. Okay. Now we're going to do the Rhine test. So this tests air conduction versus bone conduction. A positive test would be air conduction lasts longer than bone. So I'm going to ring the tuning fork again. I'm going to place it on your mastoid bone, so behind your ear, And when you stop hearing the ringing there, let me know. I'm gonna switch it to air conduction, and then I'm gonna count and see how much longer you hear it through air. Okay?
Okay.
You still hear it?
No.
Do you hear it?
Mhm. Do you want me to tell you when it stops?
Yes. You still hear it?
Mhm. No.
Okay. 31 seconds. I'm going to do the same on this side. So again, tell me when it stops ringing through your bone.
No. No.
25. Okay. Good. And now I'm going to put some pressure and I'm going to examine your otis externa and otis media to see if you have any pain. So I'm pressing. Any pain as I'm moving this around?
No.
Okay. And then your otis media. Any pain when I press on your mastoid bone?
Nope.
Okay. Pain?
No.
Any pain here?
No.
So now I'm going to use my I'm going to look at your tympanic membrane and also the cone of light in both ears. Thank you. Tympanic membrane is a pearly gray, no cercumen noted, no perforations. Cone of light in the left is seen at 7 o'clock. Coming to your right ear now and examining. Tympanic membrane is also pearly white, no cercumen noted on either side. Cone of light on the right is at 5 o'clock. Okay. Now we're moving on to the mouth. So I'm going to examine your lips, oral mucosa, and your gums. So if you could just look at me. Your lips are nice and pink, moist, hydrated, no cracking. If you could open your mouth for me. No ulcerations, no bleeding, nothing inflamed. Oral mucosa is nice and pink. I'm going to look at your gums now. No retraction, no bleeding, no inflammation along patient's gum line. I'm going to do cranial nerve number 10. This is the vagus nerve. So I'm going to have you say ah, and I'm going to see if your uvula moves up and down with your palate in midline as it should. So say ah for me, and down. Uvula goes up and down as it should. So cranial nerve number 9 is glossopharyngeal. I'm not going to do this on this patient, but it is to test the gag reflex. Next, we're going to move on to cranial nerve number 12. So this is hypoglossal. This is the strength and symmetry of your tongue. I'm going to look for any fasciculations, any deviation, that your tongue moves symmetrically and it has some strength to it. So I'm going to have you put your tongue out and move it side to side for me. Good. Symmetrical movement and then in and out. Okay, perfect. Now I'm going to look at your pharynx, your hard and soft palate, and also your tonsils. So if you could open your mouth up for me one more time. hard and soft palate are pink. Pharynx is pink, no inflammation. Tonsils are 1+, they're visible, not inflamed at all. Okay, now we're moving on to cranial nerve number 11. So this is the spinal accessory. I'm going to have you shrug your shoulders for me. I'm going to come up here and I'm going to have you shrug your shoulders up and down. Okay, and then I'm going to place my hand on your face and I'm going to have you push against my hand. Push, and then push. Okay, now moving on to patient's neck. I'm examining the patient's trachea. I see that it's right exactly down midline, equal space on each side. I'm going to have patient swallow, so I'm going to go right below the cryocrod cartilage, and if you could swallow for me. Okay, now I'm going to displace your trachea and actually palpate your thyroid gland. Any pain, tenderness here?
No.
Okay. And now I'm going to go through and palpate all of your lymph nodes. I'm looking for size, shape, symmetry, mobility, any tenderness in any of your lymph nodes. Let me know, okay? So we have the pre-auricular, we have the post-auricular, we have the occipital, we have the tonsillar, we have the submandible, submental, superficial cervical, posterior cervical, deep cervical chain, and then supraclavicular. No inflamed nodes, no tenderness when I was touching them.
Mm-mm.
Okay. And now I'm going to listen to your carotid arteries for any bruits. So I'm going to use my stethoscope. Perfect. Okay. Now I am, so I did that, I did your arteries. I'm moving on now to your chest and your thorax. So I'm looking from the front and I'm noting that his chest is symmetrical. He has, I'm looking at A&P ratio is 1:2. That is normal. I am going to have you just breathe normally. I'm going to count your respirations, your rate, your rhythm, and your effort of breathing. As I see now, patient has normal effort of breathing. He's not trying too hard to catch his breath. So I'm going to just have you breathe normally. Okay, your respirations are 14, normal, and again, no additional effort to your breathing. I'm going to begin with palpating. So I'm going to do tactile fremitus. So I'm going to feel the vibrations. You should feel more vibrations up in the upper part of the chest, and as you move down, the vibrations should lessen. So I'm going to have you say 99 for me.
99.
Say it again.
99.
Yeah.
99.
Okay, one more time.
99.
Okay. Now I'm going to percuss your anterior chest, and I'm going to hopefully hear resonance throughout my percussion. Now I'm going to auscultate. I'm going to listen for any adventitious sounds like wheezing, rhonchi, rales. So just breathe normally for me, okay? nice, clear, low blowing sounds were heard. So now I'm going to move to your posterior chest. So if you could actually just turn a little bit for me. Okay, so again, I'm looking at patient's thorax. It's nice and symmetrical, even breathing on inhalation and exhalation. I am going to palpate again, so we're going to do the 99, the tactile frematist. So if you could say 99.
99.
Again.
99.
Okay.
99. 99.
Okay, now I'm going to do chest expansion. So I'm going to put my hands around your chest. I'm going to have you take a deep breath in and out, and I'm going to see if my hands move symmetrical. Okay, again. Now I'm going to percuss your posterior, hoping to hear resonance as well. Okay, now I'm going to check for costovertebral angle. So this is for pyelonephritis. I'm going to go over your kidneys, and I'm going to percuss over, and you're going to let me know if you have any pain as I'm doing that, okay?
Okay.
Any pain there?
Mm-mm.
Any pain there?
Mm-mm.
Okay. Now again, I'm going to auscultate, listening for any adventitious sounds in your posterior chest. Take a deep breath for me. Nice and clear. Good. Good. And again. Now I'm going to check for consolidation in your lungs. So it's egophony is the test. I'm going to have you say E and hold it out every time you feel my stethoscope touch your back, okay? Okay.
E. 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 E.
Okay. Now you can come back and sit normally. I'm going to move on now, and I'm going to palpate your pulses. So I'm hoping to hear 2+ for your pulses, 2+ to 3+. So I'm going to start with your carotid. Okay, and then your brachial. Okay, radial. And then your posterior tibial. So your feet down here. And then your dorsal pedis. Okay. 2+ pulses throughout equal. Now I'm going to have you. Now I'm going to have you actually lay down, and I'm going to examine your. I'm going to examine your cardiac. So
On my back?
yes, that'd be great. Thank you. So I'm going to start by just inspecting the patient's chest and seeing if I see any abnormal pulsations. None are noted. I'm going to use my fingertips and feel around your heart for any lifts and heaves. And then I'm going to use the balls of my hands to feel for any thrills. nothing abnormal to note. Now I'm going to use my stethoscope and listen in all 5 areas. I'm going to go through your aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going in the second intercostal space. And now while I'm down at the mitral, I'm going to count patient's apical rate and rhythm. So about 68 is your pulse, regular. Now I'm going to move on and I'm going to assess for any murmurs. So I'm going to go back through the Erb's point, tricuspid, and mitral and just listen for any murmurs or additional sounds. Patient's S1 is heard the loudest at the apex and S2 is heard the loudest at the base. No murmurs noted. So now I'm going to assess patient's point of maximal impulse. So it's usually about the 5th intercostal space, about 10 centimeters from the mid-sternal. So I'm going to palpate and measure where the patient's point of maximal impulse is at. So it is at the 5th intercostal space, about 10 centimeters out. It is less than 2 centimeters. Normal rate. Okay. Now I'm going to move on to your abdomen. So I'm just assessing for symmetry, any edema. I don't see any signs of hernia. I don't see any distended veins. I see patient has a scar there. Moving on, I am going to now listen to the patient's arteries. So I'm going to go through patient's aortic, renal, iliac, and femoral arteries. Listening for any bruits. Going down to the iliac. Okay, and then femoral. Perfect. Okay, no bruise noted. Now I am going to listen to your bowel sounds in all 4 quadrants. Just making sure that bowel sounds are present. Bowel sounds are present in all 4 areas. So now I'm going to go through and percuss the 9 different areas. I'm hoping to hear timpani throughout my percussion. On the liver, you will hear dullness, and occasionally you can hear dullness on the spleen if they have splenomegaly or if it's enlarged. So, now I'm going to measure a patient's liver span. So I'm going to come up from midline. I brought a pen up here. Oh, here. Sorry. I'm going to mark on the patient to measure patient's liver span of dullness. Is about 8.5, which is a normal size liver. I'm also going to go over it with the scratch test. So the scratch test will get this. I will hear my scratching louder once I get closer to the edge of your liver border. And now I'm going to have you lay on your right side. I'm going to percuss your spleen. So if you could lay on your right side for me. I'm going to percuss your spleen. So this is through the 6th to 10th rib along the mid-axillary. So if you could actually put your arm up for me. And I'm going to percuss just to make sure that there's no splenomegaly. Okay, good. And you can move back to your back now. Now I'm going to palpate lightly. Let me know if you have any pain as I'm palpating. Any pain?
No.
I'm going to go into deep palpitation. So if you could just take a deep breath in and exhale. Again, in and exhale. In and exhale. In and exhale. Okay, no pain?
No.
Okay. So now I'm going to palpate your inferior and superior inguinal nodes, noting size, shape, consistency, mobility, and any tenderness. So I'm going to come down to your inguinal nodes. Any pain?
No.
Okay. Alright, now I'm going to do Murphy's sign. So this checks for cholecystitis. I'm going to press up and under patient's right side of the rib cage. So if you could take another deep breath in and exhale, I'm going to palpate. Any pain here?
No.
Okay. And now I'm going to check for appendicitis. So I'm going to do the McBury's test. So I'm going to, from your umbilicus, from your iliac crest. Any pain as I'm palpating here?
No.
Okay. And then the Bloomberg's test is for rebound tenderness. So if you had a lot of pain in your abdomen somewhere, I would palpate gently but deeply, and when I would release my hands, you would have pain. So that would show that you have some peritoneal inflammation. But since you have no tenderness, we don't have to perform the rebound tenderness on you today. So now I'm going to check for some meningeal inflammation. We're going to start with the Babinski sign. So I'm going to actually remove this pillow for a second. And now I'm going to lift your head up, and your legs should remain straight. And if you have to bend your legs up, that can be a positive sign for Babinski. So, okay, and patient's legs stayed straight. Next is the Kernan sign. So I'm going to bring your leg up to 90 degrees. Not this one. This patient, he has some sciatica going on. So I'm going to do his left side up to 90 degrees. So just bend for me first. And then up. Any pain?
No, just stretching.
Just stretching. Okay, perfect. We can put the leg back down. Now we're going to move on to musculoskeletal. So, if you could actually just stand up for me. So, I'm going to start by just examining patient's extremities, looking at the shoulders, I'm looking at the elbows, I'm looking at the wrists and hands, looking for symmetry, even contour, no abnormalities. Shoulders, elbows, wrists and hands, comparing both sides, looking at patient's hips, looking at patient's knees, and looking at the ankles and the feet. Looking at the overall skin and subcutaneous tissue over the muscles, joints, and bones, looking for any inflammation. No inflammation noted throughout. And I'm also just looking at the patient's muscles, comparing that they're equal on both sides with their size. So again, just looking. No swelling in the hand joints. Okay, and no swelling your knees. Now we're going to do some active range of motion. So we're going to start with your head. So we're going to do flexion. So if you could do cervical flexion and put your head forward, and cervical extension, put your head backwards. Okay, now cervical rotation. I'm going to have you turn your head to your right and turn your head to your left. And then cervical side bending, turn your head to the right and turn your head to the left. Okay, now we're going to do your shoulders. So we're going to do flexion, up, and extension back. And then we're going to do abduction. So I'm going to have you put your palm up and move it to the side. So palm facing the ceiling and up, perfect. And then we're going to do adduction, so move it across your body. Yep. And then internal rotation behind and external rotation here and up. Perfect. Now we're going to do the same thing with this arm. Flexion up. Sorry, I have a tickle. Flexion, extension, and then abduction, adduction, internal rotation, and then external rotation. Any pain as you're doing those movements?
No.
Okay, I'm just going to have a sip of water real quick. Now we're going to do active range of motion with your spine. So I'm going to have you do flexion forward, extension backwards, lateral bending, and then rotation. Any pain throughout those movements?
No.
Okay. So I'm actually going to have you just step over here just so I can examine your spine. I'm noting for any scoliosis. That would be if patient's spine was at a greater than 10-degree angle. So just lean forward for me and I'm going to examine your spine. Patient's spine is straight. No angles, no curvature. Okay. Now you can have a seat and we're going to move on to some passive range of motion. So for this exercise, you can actually lay down for the hip portion of it.
On my back?
Yes, please. So your right leg is injured, so we're going to do more so with your left leg. So for hip flexion, I'm going to have you bring your knee up to your chest. Any pain?
Mm-mm.
And so for extension, I would have patient bring hip and hyperextend it out to the side. I don't know, are you able to bring this hip down for extension? Okay, and you feel it in the back of your hip, extension. Okay. Now we're going to do abduction. So I'm going to bring this leg out and in, out and in. And adduction, we're going to move it across and out, across and out. Now I'm going to do some internal and external rotation with the patient. So I'm going to bring your leg up. I'm going to put it in a little bend. And we're going to move it out. Internal and external. Any pain?
No.
Okay. Now you can actually sit back up and I'm going to do your knees. So just I'm going to have you flex and extend your legs, flexion and extension with both legs. Okay? Okay. Now I'm going to assess patient's MCL. So this is going to be doing through abduction. So I'm going to abduction. I'm going to bring your, this is the bad leg. So I'll do this leg. I'm going to bring your leg out and press in with the knee. So this is the MCL. Any pain?
No.
MCL. And now we're going to do LCL. So I'm going to turn the leg in and press out with the knee. Okay. Now I'm going to do ACL. So this is the anterior drawer. I'm going to pull on patient's legs here. And then PCL, I'm going to push the posterior drawer. Okay, now we're moving down to ankles. I'm going to have you do dorsal flexion and plantar extension. So if you could flex and extend, flex and extend, and then flex and extend, flex and extend. Okay, so now we're going to move on to muscle strength. 0 would be no contraction. 5 would be full range of motion and contraction with patient's muscles. So I'm going to start with your biceps. So just flex your bicep up for me. Flex it, good. And then your tricep. Okay. Bicep and then tricep. Okay. Now I'm gonna check your delt and lats. So if you could put your arm forward and like kind of flex it. And I'm gonna feel back here. Sit forward for me a little bit. Okay. Full contraction, and then this side, full contraction there. I'm going to test your grip strength, so if you could squeeze my fingers as hard as you can. Okay. Now I'm going to assess strength of your hip. So what I'm going to have you do is I'm going to press my hand here and push your hip up.
My leg?
Yes, push your leg up. Okay, good. Can you do it on this side? And then I'm going to look at your quads and hamstrings again with flexion. Full strength, full strength. And then again with the toe flexion and extension for strength.
Ankle or toe?
Yeah, just your feet. Full feet up and down. Good. Up and down. Okay. Now I'm going to assess your reflexes. So this is again, normal reflex would be brisk, and it'd be 2+ to 3+. So I'm going to start with your triceps. So if you could just relax your arm at your side for me. Okay. Okay, and your bicep. And around. And then your brachial radialis. Okay, just relax. There we go. And then your patellar, so just like sit back a little bit and relax your legs if you can. I know it's kind of, there we go. That will work. Yeah. Let's do this leg. Okay, now we're going to do your ankle jerk. So I'm going to look at your Achilles, and I'm going to kind of just let your foot hang a little bit, relax it. Okay, and now this one. Okay, and then Babinski, I'm going to slide this up the bottom of the sole of your foot, and normally your toes should curl while I do that. So can I see this one foot? Okay. Okay, ticklish.
Yeah.
Let's do this foot. Okay, perfect. Reflexes are all intact. So now we're moving on to coordination. I'm going to have you do rapid hand movement. So if you could do this with on your legs as quick as you can. Okay. Now we're going to do finger coordination. So thumb to finger on both sides. Okay. And now I'm going to do leg coordination. So I'm going to have you take the heel of your foot and run it from the shin down to the bottom of your foot. And then this side. Okay, now I'm going to assess your gait. So if you want to stand up with me, I'm going to have you just walk normally first. And I'm assessing the swing of your arms, your base, your stance, symmetrical, and smooth. Okay, and then back to me. Now we're going to do tandem. So I'm going to have you do heel to toe and walk, heel to toe. And then back, walk on your toes. Now you can walk on your toes. Yep.
It's normal.
Yep. Okay, and then walk on your heels back. Okay. And last thing I'm going to do is the Romberg test. So if you could come stand over here, your feet together, arms at your side. And I'm just going to have you close your eyes for 20 seconds and make sure that you don't lose your balance, you're not swaying, and you're able to close your eyes and stand still. So close your eyes for me. Okay. No swaying, patient stayed standing. He didn't lose his balance. This concludes the head to toe assessment. Thank you.